So, wasn't it amazing to listen to my last episode on Mary's take for us on nutrition, on bringing down inflammation, on what the things are that we should be watching for at this stage in our life, how much protein intake that we should have? Holy moly. I really love that she based her program in that premise. Now, you're going to hear part two. And part two is going to draw us into a different aspect of women's health during these menopausal phases. Let's talk about symptoms, ladies. Hot flashes, night sweats, having to get up several times during the night because your sleep just isn't great, maybe even crankiness during the day, mood swings that you've never seen before. There are so many symptoms that come in this perimenopausal to menopausal part of our life because our hormones are drastically changing. Remember how they changed really fast in adolescence? Maybe you remember. Maybe you just know that it happened because you know that there were some really awful things happening to your face and your body and all the things back then. Well, guess what, guys? This is like the second phase of this. Is major hormonal changes happening all at once. So we want to hear what Mary has to say today.
I know your deep, dark secret. You don't like your life. You're a woman in midlife, and for the past 2 decades or more, you've poured yourself in to other people. You've poured yourself into your career, your family, and yet on the inside, you feel broken. And that's no way to be. I'm Dr. Natalie Marr. I'm a clinical psychologist and a life transition expert. It wasn't too long ago that I was in your shoes, waking up in my early 40s, thinking I've got 2 failed marriages and I'm a single mom for the second time in my life. And I just knew that I could do better, that I could feel better. Fortunately for you, I have about 20 years experience clinically. And so I've created a method that will help you learn to love your story. I know that the story that you're telling yourself about your life feels awful. And I know that you think that you can't change that. I assure you, you can. And when we work together, I'm going to help you to craft a different story, a story that you love, a story that makes you want to get up every single day.
Welcome back. Now, if you haven't joined us for our first episode, please press stop right now. Go back to that first episode because Mary Bushkuhl is going to teach us about women's health during this phase of our life, midlife. And it's really great stuff, but I want you to hear all 3 parts of this series. And today's is part 2 of the series. So I am excited to have you hear a little bit more about symptom management and recognizing our symptoms and learning to ebb and flow with our health here. If you haven't heard, let me introduce you yet again to Mary Bushkuhl. Well, let us welcome Mary Bushkuhl to our podcast. Let me tell you a little bit about her before we get started. So Mary empowers others to architect their dream so they can live the adventure of their full potential. And her personal mission is to be a constant positive force, maintaining the highest ethical integrity and striving to always do the right thing. The strength of what Mary Bushkuhl does lies in a deep respect for education and staying on the cutting edge of the latest research and trends in the areas of health and wellness. She is compassionate and empathetic and an outgoing personality, which allows her to get along with people from all walks of life. She also has a deep desire to help you feel better, look better, and improve your outlook on life. Her specialties include senior fitness, high school, collegiate, and adult athletes, weight loss or weight gain programs, individuals with health challenges, programming for the menopausal woman. And that is why we have invited her to be with us today. So welcome, Mary. Thank you so much for being on the podcast.
I am excited, Natalie, and I hope that I can drop some major gold nuggets to help women in this part of our life.
So listeners, we're meeting this week with Mary to talk a little bit more about the symptoms of menopause, what to be expecting, what you should be looking for, or what are you noticing that's changing? Because I think if you're earlier, if you're one of my younger listeners, you might not know what these are yet. Some of us that have been steeped in it for a second definitely know what these symptoms are. And then Mary's going to share with us some strategies for how we can manage that a little bit better. So go for it, Mary. Jump right in and tell us what should we be looking for and what should we know about this phase?
Okay. Well, when you are going through your menopausal cycle, you have a predicted change in hormones. Your estrogen slowly goes up to a certain point before you hit, and then it starts going down when you hit your period. Your progesterone kicks in later in the cycle. Your luteinizing hormone also is peaks after your estrogen peaks. And then your follicle stimulating hormone also has its own little wavery course throughout a menstrual cycle. But once you start hitting the menopause transition, everything's all over the place, especially estrogen and progesterone. Your estrogen might be dominant one day or one cycle, and the progesterone low, and it might flip, and it's a shit show.
It's a shit show. It's a shit show. I'm wondering, Mary, if you could help my listeners, because some of us know, some of us don't know, but could you give us kind of an idea of when estrogen's high, what are the things we're noticing? When progesterone's high, what are the things that we're noticing?
Estrogen stimulates tissue growth. It stimulates the contraction of your uterine muscles. It promotes edema. So when at that point in your cycle, when you start retaining water, that's when estrogen is at its high.
She's not my favorite when she does that.
It also promotes inflammation. So those of you who have more issues with arthritis, you start to feel the achiness coming on more. When your estrogen is at its peak, that's when your immunity to disease is at its peak. So you don't usually get sick. You don't usually get sick when estrogen is at its peak.
Oh, interesting. Yeah.
It's when you start coming down. Now, when progesterone's not that high, you might find you might not sleep as well. And then when progesterone hits its height, man, I can sleep like a baby, type thing. Progesterone also decreases edema. So after you start your period, then you start to flush out all of that water retention that you have. It can promote pro-inflammation, but it also anti-inflammatory. So you've got those two things. And it also is an immunosuppressant. So in other words, you are more susceptible at that point to illness and also injury. So that those are when I'm working with athletes, you have to take into account, okay, during this part of the menstrual cycle, we want to not do a lot of agility kinds of work. We want to kind of try to keep things right in here, but that's for exercise.
That's interesting though, because I have heard of it spoken that way, that estrogen is kind of our go-getter hormone. And so you're more motivated, you just are a go-getter. It's the energetic one. And so if you're stacking things in your life around your cycle, you would stack kind of anything that's going to need that kind of energy with it. And it makes sense to me then that your immune is boosted, your immune system's boosted. There's things that are kind of protecting you in that. But when progesterone's high, which is the latter part of your cycle into menstruation, you need to be more careful with yourself, kind of giving yourself more of that soft self-care, more resting time, not putting yourself through any paces. And I guess that's both physical and mental then in that part of your cycle, kind of leading up to the menstruation itself. But the cycle, even when your menstruation is happening, not happening, or light during that perimenopausal phase, there's still kind of a peak in the front part of the month, front part of the 28 days. And then that last week of it is more the progesterone. Am I correct?
Right. And it could be, and it couldn't be. You never know. You never know. I mean, estrogen may not show up one cycle or be very low, and you look at your menstrual cycle. The menstrual cycle can be shorter. It could be longer. It could be heavier. It could be lighter. It's all of these things. One day you may wake up and you go, "Oh my God, I not only do I need a tampon, but I need a pad, and I need all of these things."
Yep, the struggle is real.
Understanding that as estrogen withdraws from the body, and progesterone's also doing its own little dance. We also have testosterone, and women do have testosterone in their body, and that also comes into play with helping with your energy, helping with your sex drive, helping with recovery after physical bouts. So testosterone also comes into play within this time but it's not as important as the estrogen and progesterone, because those two things fluctuate all throughout the menstrual cycle. Testosterone is just like it's the special teams. I guess you could call it.
It's the special teams. I like that.
One of the things, like as your hormones fluctuate, and like I said in the nutrition portion, our anabolic stimulus plummets. So catabolic, in other words, breakdown goes way up, and our ability to build muscle, build bone, tanks, I guess you could say. It tanks. So protein synthesis, which is actually utilizing protein to build muscle, is low. So that comes in. We increase the amount of subcutaneous fat that we have in our body, especially visceral fat. And what visceral fat is the fat around our organs. So you may not physically be able to see it on your body, but it is starting to build around our organs. So that's and intramuscular fat also increases. So we start to look softer. So if you were leaner when you were younger, if you were leaner and ripped, and all of a sudden you're soft, which has happened to me, that's normal. It's not like, okay, I've got to exercise more and eat less kind of thing. So those are the things that happen as our hormones fluctuate. Metabolism wise, when our hormones fluctuate, our insulin sensitivity goes down. So insulin resistance goes up. In other words, our body's ability to take glucose in from the bloodstream is compromised. So we have all this circulating glucose, and our body can't use it for energy in activity, so it stores it as fat. So we've got to there are strategies to try to help improve your insulin sensitivity, and that'll come with exercise. We'll talk about that in the exercise. We have a decrease in the amount and the reliance on carbohydrates. And again, that comes to play in how the body's able to pull in the energy that it needs for physical exercise or physical activity. And so it starts to be stored as fat again. And we talked about in nutrition, there is a huge increase in the amount of total protein that we need. And that's the metabolism part. Now, cognitively, and this is where you're going to go, okay, I need your ear, Mary. I mean, you got my ear, Mary.
Okay, listening.
Estrogen stimulates serotonin and decreases the breakdown of serotonin. So when that leaves, we have no way of breaking down the serotonin. So we have no way of utilizing the serotonin, which is so important for sleep.
It's important for sleep, but it's also, one of these hormones that's one of our feel-good hormones. I've talked about it in my podcast before, and it helps us with things like gaining, like feeling like we have purpose, feeling like we are in alignment with what we want to be doing in our lives. And so that listlessness that we start to feel in this age range can come from not being able to use our serotonin or not efficiently be using our serotonin. So it's, also a symptom of depression, right? But there's kind of this normal depressive like state that shows up in our lack of motivation and our listlessness about what our purpose is, which then pairs up with this huge life transition where our kids are aging out of our homes if we were parents. Our jobs are looking different because of our age and other people coming up the ranks, so to speak, and they're the new, the ingenuity of the newness of the younger generation. And so it's like both environmentally, there's a reason why this is happening to us, but also biologically, why this is happening to us. Yeah.
Well, you just described my whole 2021 in a nutshell there.
Exactly.
My serotonin left the building, or the serotonin's in the building, but nobody can get to it.
Nobody can get to it. Nobody knows how to use it anymore. It's like, that's exactly right. And which is so, it's such a fascinating concept that our bodies just are not functioning in the same way any longer. Mm-hmm.
So let's get to some of the symptoms of menopause. So, of course, we all know night sweats and hot flashes. 80% of women have those. I have been fortunate not to have those. So, and I think the reason why is because I have been so active in my life. I don't know if that's true or not, but I'd have to ask my sister if she had anything like that. I have no idea, but I never had those. But there are 34 symptoms in the menopause transition. And so I'm not going to tell you all of them. I'm just going to mention a few. But sleep disturbance, serotonin, um, focus. Let's go ahead and throw serotonin in there again.
Serotonin in there, a little dopamine.
We've been talking about joint pain and what they call menopause arthritis. Unusual tiredness. And that was, if you remember in my introduction, I had unusual tiredness. When you were talking about, when I was talking about anxiety, the amount of anxiety that I was having, not understanding what my purpose was anymore. And so that came into play. Libido. Our libido, 67% of women have issues with decreased libido. And some of the reasons why that is because of some of the other symptoms of menopause, which includes vaginal dryness, which can lead to discomfort in the sexual act. So urinary frequency. There are fixes to all of these, but the other one, I hate this one, but facial hair.
Facial hair. Mm-hmm. That's happening. That's real.
I think I remember what it was in my 30s when I started having the little missteps, is the mood changes. All of a sudden, I would have an irrational response to something that is normal in everyday life. And I'd have an irrational response and I'd go, where the hell did that come from? So there are 34 symptoms. And when you take my course, I give you a scorecard. And on that scorecard are all 34 symptoms. You check all the ones that pertain to what you're feeling. And then I have you take the top 3 because you can't focus on all of those.
You can't focus on all of them. And honestly, I imagine if you're trying to address some of them, you kind of address, the other ones as well. Because if you're doing some of these adaptogen or biological interventions, it should be helping kind of bring the table down on all of them.
This is how I go through the program. We talk about hormone therapy, menopausal hormone therapy, pretty much estrogen, progesterone, and testosterone. Estrogen being the main one. And when you are considering hormone therapy, you want to do it for the symptoms themselves. If you're having hot flashes, if you're having night sweats, if you are having, and this plays into the libido part, then estrogen might be something to consider because it helps. Now, hormone therapy is not for helping you to lose weight. That's not the intention. Because a lot of women are like, if I could just get this weight off, and I could do that through hormone. No, it's not for that reason. You're not taking estrogen for that reason. A lot of women fear estrogen hormone therapy because of one study that was done back in the 80s that the press blew all out of proportion. It was the statistical significance was like 2.6%. I mean, nothing. So if you think that estrogen is going to increase your risk of breast cancer, it's in most cases not. Now, if you have a very strong family history of breast cancer, talk to your doctor because talk to a doctor who's knowledgeable in menopause, and they can help you navigate this. But estrogen has been a lifesaver for a lot of women because now being able to help to control the night sweats, the hot flashes, their lives get better. They're able to sleep more. All of these things come into play. They don't have to change their clothes 7 times a day, those kinds of things. So hormone therapy definitely is something I would strongly encourage for women who have night sweats, hot flashes, anxiety.
I really appreciate that you suggest that and that people talk to their physicians about it, because I think we need to debunk the women's health study from the 80s that told us that heart disease and cancer were going to be just inevitable if we started hormone replacement therapy, because quality of life is important. And there's lots of diagnostics that weren't there in the 80s, by the way, that are here now. And so you can kind of balance that out and see, are there other indicators and other ways for you to manage the other risks if they're even there. But I would go back again to who did they study? And there was a lot of postmenopausal women that were in that study. It wasn't your usual demographic that's going in for HRT now. Mm-hmm.
And then besides estrogen, progesterone was, for me, a game changer. I was having very disruptive sleep. I was getting 3 to 4 hours of sleep a day. And then my doctor, when I first started having issues with sleep, I was talking to my OBGYN, and she was like, oh, you're having, okay, you have sleep problems. So she would prescribe Lunesta or Ambien. She wasn't even looking. Now this is almost 20 years ago. We didn't know all of this stuff, but it was a menopausal symptom that I was having. And if it was addressed in that way, I think I would have been a lot better off instead of the Ambien or the Lunesta. And they really didn't help me. Yeah, they helped get me to sleep, and I was able to sleep 4 hours, but bam, I'm awake again because all this stuff that's going on with the hormones withdrawing and all of that. So, but progesterone, because what we talked about, progesterone is a relaxant. It helps to relax you. It helped me to be able to go to sleep at night, and better than those other prescription drugs. So progesterone definitely, if you're going to get estrogen hormone therapy, they definitely will bring the progesterone in. The other one is testosterone, and testosterone can be a hormone therapy as well. I don't use replacement because it doesn't. they don't replace what's already gone. So, but testosterone, I wanted it. My main concern was um, improving my energy, helping with recovery, because I try to still be a very active woman, but I've changed the way that I'm active anymore. And then the other one was a libido. Maybe it could help me with my libido. And I did that for a while, but then, some of the side effects, the only side effect I ever had was a little bit more hair. But you could start having male pattern baldness. You can start having a deeper voice. All of these things. So you have to be your healthcare provider who's providing the hormone therapy has to be monitoring you a lot. Another thing is testosterone also thickens your blood, increases the amount of iron in your blood. I had to, even though I was under 110 pounds, because to donate blood, you have to be at least 110 pounds.
Did not know this.
I would have to, if you didn't know that, you need to know that. So I would go, I'd have to get a doctor's prescription to have blood taken out of my body. And they couldn't take the full pint because of my weight. So they could only take a certain amount. And I was at that time, I've had to have two, during that time, I had to have two not transfusions, but blood taken. But they couldn't keep or use the blood because it wasn't a full pint. And I'm like, are you kidding me? This is such a vital part of what we need. And you're telling me you can't use this? So anyways, so that's one of the things. If you do have testosterone hormone therapy, the doctor will be looking at your blood count every year and then might be sending you in to have blood withdrawn so that you can build the iron back up in your body, because it's your blood's gotten too thick. And so that's one of the anyway. So other than hormone therapy, those are the only three: testosterone, estrogen, and progesterone are the only three hormone therapies that you can have. The other thing is your prescription drugs. And this is where you would know more than me on the prescription drug side of it. But you're looking at your SSRIs, things, prescription drugs that they use for depression, helping for serotonin uptake. All of these things, your doctor has to prescribe those. A lot of women are kind of like, I don't want to have to take an antidepressant. I'm not depressed. And it's like, well, there are other reasons. And if your doctor can explain that to you, the reasons for helping you to be able to navigate those symptoms.
Yeah, because your normal anti-anxiety and antidepressant medication is a SSRI. Usually, it's a selective serotonin reuptake inhibitor, which means that the recycling system within our neurology gets blocked. So serotonin gets to sit in a synapse longer, which is the space between nerve cells, so that it's supposed to upregulate our ability to be efficiently using that serotonin. Because if it sits too long, then the vacuum system and recycling system kind of sucks it back up and regurgitates it into some other neurotransmitter. And we just want to have the serotonin sitting out there long enough that the other neurons start to make receptor sites to pull that into your system. And like you said, serotonin is not being used as well. And there's other reasons why our system uses serotonin. So while you might not be depressed and you might not be anxious clinically, a clinical psychologist is going to diagnose that in you. Those same medications can improve your ability to use the serotonin in your system and then alleviate some of those symptoms. Mm-hmm.
And, Dr. Natalie, I feel that is an episode you should do on your own about sleep, about the medications and how they work to help you with that, because that is so important. And especially in this time in our lives, because so many things are changing, not just within our bodies, but within our environment around us. understanding the importance of sleep. And women, especially if you've had children, you know sleep deprivation, especially when they were infants. I mean, were you at the top of your game? No.
Yeah, because the other thing that people don't know, people have heard about melatonin with sleep, but it's a serotonin melatonin sister system that, serotonin comes out in our body when the light starts to rise in the morning, and that tells our body to be awake. And when the sun sets and it's dark, melatonin starts to come out to tell our body to wind down and go to sleep. And when there's disruption in that balance, then there's disruption in our sleep as well, which it's a big deal, people. When you don't have sleep, I told Mary when we were prepping for this, we locked some college kids in a basement in the 60s and 70s and found out if you don't let people sleep, they go psychotic. Quite literally, it causes mental health problems. And so if you're only getting 3 to 4 hours, wow, of course your capacity for life is just way reduced at that point. Mm-hmm.
So we have hormone therapy, we have the prescription drugs, and then the next thing are adaptogens. And those are plants, or they have plant compounds in them. And adaptogens, there are two kinds. You have your calming adaptogens and you have your stimulating adaptogens. And some of you may be familiar with some of the calming ones because we can have them in our teas. So understanding what a stimulating adaptogen is and what a calming adaptogen is important, and how they work for the body. If you are a person who needs, your energy level has just gone down, then using things like ginseng, rhodiola rosea, that one's a good stimulant. But there's maca. Maca's really big. A lot of people are using maca, and they're even trying to use it for weight loss. And I'm still on the fence about that. But when you are looking at an adaptogen or trying an adaptogen, remember to only try one at a time, and only for a month. Try it for a month before discarding it. If you don't feel anything after a week, stick with it for a month. Be curious about this. And so you have those are your stimulating ones. And then you have your calming ones, ashwagandha. Everybody knows about ashwagandha because it's showing up in everything. It seems like every supplement that you can think of has ashwagandha in it. Also, holy basil is another one. Now, I was going, okay, I need a calming because I'm not sleeping, and I'm anxious. My anxiety was diagnosed, and so I was going, okay, ashwagandha is what I need, and so I tried ashwagandha, and I tried it for a month, tried it for a month and a half, tried it for 2 months, and I was not getting what I needed, that calming. And then my psychologist, who I continue to see now, she said, you have, I'm not going to diagnose you, but you have the tendencies for ADHD. And as you know, as a psychologist, people who have ADHD in their brain, they have a completely opposite response. So I switched to a stimulant, the rhodiola rosea, and that worked to help me calm down. Yeah. So again, be curious. Be curious about that.
Be curious and be self-aware of your body, and listen to her, because she knows what she's talking about. Like, she'll tell you what she needs and doesn't need. Yeah. Mm-hmm.
One thing I did want to tell you about the rhodiola rosea, which really, when Jessica told me that about the ADHD, and I can send you this study to look at, but they showed that with rhodiola rosea, in this study, that the psychological symptoms, once a person started taking the rhodiola rosea, the impairment of concentration went down. In other words, your concentration level went up. Your irritability went down. I mean, your irritability, your anxiety went down. The loss of zest for life, actually, all of these things went opposite of what they thought it would. And the rhodiola rosea for me, and it showed up in this as well, serotonin uptake improved.
Yeah. So it's funny because stimulants, when we think stimulant, we think things like caffeine and we think about energy, like extra energy for our body. But what you're describing is there were parts of your brain that were underworking and they needed stimulation to get to optimal working again. And so stimulants can take in our nervous system can kind of spur that along. And this is why with ADHD, stimulants have always been the pharmaceutical choice when we give medications to kids like and adults with ADHD. It's a stimulant because we have underworking parts of the brain. And they're underworking and not letting you to be able to keep focus. So they'll kind of try to focus on too many things at the same time, or they're underworking in that they can't shift focus. They want to focus on the thing that's loudest over here and not be able to let the parts of your brain that can shift your focus work. And so we're stimulating those parts of the brain. But I think it's a great thing to remind us all of, is that stimulant and relaxant isn't just about the mind, but the body mind interaction. And for some of us, it starts with that nervous system control, right? The brain and nervous system kind of controlling what the body is going to do. And we have to stimulate that in order to relax the parts of the body. So you have to stimulate the part of the brain that relaxes you to go to sleep. And we have to stimulate the part of the brain that lets you focus. Yes.
Right. And then the last adaptogen are mushrooms. And I go into detail about different kinds of mushrooms and how they can help depending on the symptom, if they can be of help to you. And again, just like with the stimulant or the calming adaptogens, try one thing first. And with mushrooms, combining the mushrooms with certain adaptogens will only enhance that response. But sometimes you don't want to have an adaptogen or a stimulating adaptogen with a particular mushroom because it can wreak havoc. So understanding that, and those are things that I give you in the program. And I'm not talking the kind of mushrooms that we hear about, that
the hallucinogen mushrooms. Okay. I was going to ask, cause I don't know. I mean, you're in the Western part of the hemisphere. I can't remember if Wyoming lets us do microdosing in mushrooms yet. I know that Washington and Oregon do.
Yeah, I don't think so. They're a very conservative kind of state. And then there are some other supplements that I've or that are part of this controlling the symptom, not controlling, but managing your symptoms, that I'll address as well. And we talked about that in the nutrition part, the magnesium helping out and creatine helping. So those are brought back in, plus some other supplements to consider as well.
In this symptom management part of your 3-phase course on managing menopause symptoms.
Right.
In review, I'm just going to go back. Like we've talked about, like there's more than 34 symptoms of menopause. We kind of highlighted some of the big 5, or something like that. But there's many, many. So educate yourself, listeners. Please educate yourself, because you should start recognizing if those are happening, even if you're in that earlier stage. Heading into perimenopause, and that hormone replacement, adaptogens, and even supplements are things that we should be considering if symptoms are interfering with the quality and functioning in our life. Nobody's getting an award for putting up with it through sheer willpower. And quality of life is important, especially I think at this stage of life. I mean, we've earned it. Let's be real. We've earned it. So make sure to consider those things.
You don't want to be a martyr. You will not be put on a pedestal after this life for trying to get through menopause without trying anything.
I mean, I can't even ask my grandmother if she did hormone replacement therapy because she passed before I would ever have thought to ask a question like that. But she would have told me you get another crown or you get another jewel in your crown in heaven. Like, I don't care. Like, I'll go without it. I just want to have a quality of life now so that I can show up my best and do what I need to do to have a centered life, thriving. And I hope that you do too, my listeners. Because I am a licensed clinical psychologist in the state of Minnesota, I have to make sure at the end of each of these episodes that I give you the disclaimer that none of the material that I talk about in these podcasts is meant to replace any kind of therapy or formal medical or mental health treatment. And in fact, anything that I offer on my website, my coaching programs, any kind of psychoeducational materials that I release are not a replacement for that level of care. So just take that into account when you listen. This is information for you, and hopefully you find it of value, both as an educational tool and for your entertainment. And I also want to mention that if anyone you know is in a mental health crisis, needs additional help, I always include these two crisis resources. They're available to anybody. Pick up the phone and dial 888 for the National Suicide Prevention Lifeline. And you can always visit their website at suicidepreventionlifeline.org. Additionally, there's actually a crisis text line. So if you're not somebody that likes to pick up the phone, then please text 741 to the crisis text line. And you can find them online at crisistextline.org. Thank you for listening to my podcast, and I hope that you like and follow me wherever you get your podcasts, and maybe consider leaving me a review. It always helps me to keep this podcast relevant when I know what you want to hear about.